Injection and infusion coding is a challenging area due to the vast instructional notes, the hierarchy rules, and the payer-specific policies. Now, the code ranges are from 96360 to 96549. Now, injection delivers a dosage in one shot rather than over a period of time. It may be administered by various routes, including subcutaneous, intramuscular, intraarterial, and intravenous. So an example would be a medication for an immediate effect would be considered an injection. Now, infusion, administration of intravenous or IV fluids and or drugs over a period of time for diagnostic or therapeutic purposes. An example would be a medication or solution provided through saline or other solutions given over a period of time. An IV push, so an injection in which a healthcare professional who administers the substance or drug is continuously present to administer that injection, and they observe the patient. So it's usually an infusion of 15 minutes or less. Now, some things to ask yourself when assigning an injection code or infusion code. What did the patient receive? Are they receiving chemotherapy, non-chemotherapy? Is it an injection, an infusion, an IV push? How was it given? Was it through the IV? Was it subcutaneous? Was it intramuscular? Was it a combination? And then how long did it take? So what is the time? It's important to know the time. Less than 15 minutes, more than 15 minutes, the hour, or any additional hours. Now, a couple just coding tips. When multiple injections or infusions or combination services are provided, the coder will report that initial code just once, except when two separate IV sites are required. You're going to have more than just one code. Now, when the length of the infusion time is included in the code description, report the code based on the actual infusion time. So those start and stop times, know these. They're important to know when those stop and start times are, and it should be documented in the medical record. Cardiac catheterization. So cardiac caths are very complex, and it's important for the coder to make sure to read carefully all the information within this section of the CPT book. The most current language, the guidelines, the parenthesis instructions, and each section and subsection. Having a CPT catheterization table is very helpful, and one actually should be located in your CPT book in the medicine section for cardiac catheterizations. Now, a left heart cath includes the intra-procedural injections for left ventricular, left arterial angiography, and imaging, supervision, and interpretation. It also includes the measurement of oxygen saturation, and cardiac output when performed. Now, a right heart catheterization includes the insertion of a Swan-Ganz catheter. So if a Swan-Ganz is used for monitoring purposes only, the coder would choose 93503. Now, a right and left heart cath, they include all these left heart cath components like mitral and aortic valve functions, left side aortic valve regurgitation, and angiograph evaluation of coronary arteries and left ventricular conditions, so such as mitral valve regurgitation, stenosis, and aneurysms. Now, the right heart cath and left heart cath with coronary angiography would be coded to 93460, but if a bypass angiography was performed, the coder instead would code 93461. And we're going to go to, real quick, cardiac caths. We'll go through this section in part 3 before this time runs out.